Good afternoon. Welcome to the July 2024 Arkansas All-Payer Claims Database Users Group. First of all, can I have some confirmation? Are you able to hear me? Yes? Thank you, Nicole. I'm trying to move. There we go. Thank you very much. And see me, and everyone is able to see the presentation? Yes?
Indeed.
Thank you. All right. So this is our 20th Data Users Group session. And for those of you who've been on all of them, I salute you. That means with 4 years, we've been doing this for 5 years, and this is probably the 21st or 2nd, because the first 2 we did were in person at UAMS. And then we realized we had to reach a broader audience, and we went to the webinar format. So 20th Users Group session. My name is Kenley Money, for those of you who may not know, and I'm with the Arkansas Center for Health Improvement. And my team they administer the data assets in the Arkansas Healthcare Transparency Initiative, or HTI. That includes the Arkansas APCD. So let's take a look at the HTI. If you've been to our website, you've probably seen this infographic, but this infographic lists the data inventory in the Healthcare Transparency Initiative. The 2 big data assets in this are the APCD and then key data assets from the Arkansas Department of Health. And the large part of this graphic includes the inventory of the APCD assets. It includes data from private carriers and public payers, commercial plans, Arkansas Medicaid, Medicare, I'm going to talk about that in a moment, data from Arkansas state and school employees, some Arkansas workers' comp data, Medicare data, Medicare fee-for-service data is sourced from ResDAC. We purchase it, it's always about a year late. You can see in the data there. And, excuse me, and it's available to state agencies, not to the standard data user. Then we have the data from the Arkansas Department of Health, key data assets here. We have the emergency department and hospital discharge data. You see that's asterisked because the data we receive from those sources is for those who have marked self-pay or are uninsured. We don't get the full data set there, just those 2 areas. Then we get birth certificates, death certificates, cancer registry data, medical marijuana card holders, and they all have differences in available data. And I can tell you that the medical marijuana cardholder data is different now. We have data through December of 22. This graphic needs to be updated, no worries. So, but the latest graphic is on the website. This is a placeholder. It gives you an idea of what we have. All right, okay. So today's agenda was developed using data user input. And in the future, if you have ideas for topics, please let us know, either by entering ideas or questions in the chat or by emailing us. And perhaps they'll be used as future agenda items. Some housekeeping rules before we move forward. Again, feel free to put your questions in the chat at any time, and we'll address them as we can. And at the end of today's session, we will provide a link to our service desk application where you can enter a question or a topic you would like to discuss. The APCD can be very complicated. It's a big beast, and you can also request time with our team to talk about questions that you may have, how to use data, how to manage it, anything like that. We are here. Our data is not valuable unless you can use it and you find value in it. The link to this deck will be provided in a follow-up email, maybe this afternoon, could be in the morning, and that link will include the presentation and a recording of this webinar. We're being recorded now. But I want to remind you that all of the data user group webinars that we've had, all 20, are on our website. So if there is a question that you have that wasn't covered today, the chances are very good that we have covered it before. So I urge you to go to the arkansasapcd.net website, and there's a button there that says Data Users Groups, and go see if you can find what you need. Of course, you can ask us, but you might be able to find what you need without having to ask. The answer might be right there. I expect we'll have some time at the end. You can hold your questions until then. Again, the more voices, the more interesting, the more we'll learn together. Finally, the next data users group is October 24th. We hope that you find today's session valuable and informative, and look forward to the next one. Today's agenda, let's go there. The featured topic is maternal and infant health focused analytics. We've been doing a lot of work in this area with the Arkansas APCD, and we want to share what we've done and some approaches that we've taken. The second topic is how to use the member enrollment selection table, or MEST. Now, if you attended the last session, the one in April, we did talk about this then, but some users have actually used it now, and they had some feedback, and we want to share that with you. This is a really interesting tool, and we think it can help make some of your work easier, so we want to focus a little on how to get the best out of it. And then lastly, we're going to talk about the latest APCD release. We've updated, we have more data, and I'm sure you'll be excited to hear about that. Our presenters today are me, Kenley Money, Director of Information Systems Architecture, APCD Director at ACHI, and then Dr. Nicole Stanley, Interim Director of Analytics at ACHI. With that, let's move to our first topic, which is maternal and infant health focused analytics, and Dr. Stanley will take you through all of that. Nicole, I'm going to change this slide, and you just tell me when to move forward.
Thank you, Kenley. As Kenley said, my name is Nicole Stanley. I am the Interim Director of Analytics here at ACHI. I've been at ACHI using the APCD for 7 years now, and it's been really fun. I do love data. So what we're going to talk about today is, as you guys probably have heard, Arkansas consistently ranks in the bottom when looking at women and infants' health. For several years now, it has been one of ACHI's strategic initiatives. So we have done a lot of work in this area. You may also know that just in, I think, April, Governor Sanders formed the Arkansas Strategic Committee for Maternal Health. They were tasked with studying the issues and developing strategies to address. So we also took that opportunity to produce a lot of analytic output over the last few months. The first thing I would like to share with you guys, we actually did this analysis in October. We were looking at the C-section rates by county of residence in 2019 and 21. Next slide, please. So the C-section rates are for first birth deliveries by county of residence. A first birth delivery is a full-term pregnancy, so at least 37 weeks, not multiples, singletons only, and they had to be in a head-down position. What you can notice immediately is that 15.2%, the rate for the lowest county was 15.2%, and the highest was 45.3%. Now, these particular mothers, in theory, should not really be expected to have a C-section. Typically, the rate for a first birth, low-risk delivery would be about 23%, if I remember correctly. Now, data-wise, an interesting thing that you have to keep in mind when you're looking at this kind of information, we use the Arkansas Department of Health's birth records initially to identify C-section rates. However, of course, Arkansas birth records are for infants born in Arkansas. So any out-of-state births we don't capture. So we run into the problem of border counties, especially Little River and Miller County, where Texarkana is. I don't know if you're aware of this, but there aren't really hospitals down there in the Arkansas side of Texarkana. People go and deliver their babies in on the Texas side. So in order to get accurate information for the corner, the southwest corner, we went to the APCD and looked at claims. We identified the claims using Z codes to identify a birth event, and we assigned the county based on the mother's residence. So let's go to the next slide. Another metric we looked at were teen births and birth spacing from 2016 to 2018. We wanted to look at teen births because obviously that's a problem. Again, Arkansas is ranked pretty low when it comes to teen birth rates. Next slide, please. So this, again, we had a situation with this data. We used the birth records first, and then we saw the southwest portion of Arkansas looked extremely low. And so, of course, we had to go to the APCD and identify birthing claims there. And then we supplemented that information here. And actually, let me check. So for this particular study, we wanted to capture any out-of-state births and supplement those here. So this is not just births that occurred in Arkansas for Arkansas mothers. Well, I'm sorry, it is for Arkansas mothers, but we captured all of the births. Let's go ahead and go to the next slide. This was also an interesting study. We were looking at interpregnancy interval. This time we were able to use the birth records, so we didn't use any claims here. You can see, unfortunately, we have children 13 and under that are giving birth. One of the major concerns with birth spacing in general is that mothers try to wait 18 months or more from delivery to conception. So in order for us to calculate birth spacing, we linked birth certificates across mothers and then subtracted gestational age from the date of birth of the second child born. And then we were able to calculate interpregnancy interval. You can see that many of these girls are having them before the 18-month recommendation. Let's go to the next slide, please. One of the more impactful, I think, and by that I mean there was a lot of interest generated in this particular study, was a look at the median minutes for travel time from the mother's residence zip code, actually, to the delivery facilities. Can you go to the next slide, please? This is a particularly important question because as of 2024, in April, 60% of rural hospitals no longer have labor and delivery. So mothers are having to travel further to get to deliver. And we know that increased travel times are associated with higher risks, both for the mother and the babies. What we found for 2022 was currently over a quarter of Arkansas moms are traveling 30 minutes or more, and 8% are traveling 60 minutes or more. Again, for this particular study, we used the birth certificates in the hospital of delivery and the mother's zip code residence. We supplemented here also with out-of-state births from the APCD. Again, it's really important to capture those border counties, especially for travel time, how far mothers are having to travel. let's go to, and you can see here that the median minutes are traveled right now for the state is 16 minutes. And that we have the range of anywhere from 2 minutes in Pulaski County all the way up to over an hour. Kinley, let's go to the next slide. I want to look at a couple of examples. I think this is very interesting. You can see that in Phillips County, for Phillips County residents, in 2020, Helena Regional Medical Center stopped offering labor and delivery, and the difference in median time to travel went from 6 minutes all the way to 51 minutes. For them, the next closest birthing hospital is about 47 minutes away for the majority of mothers. Next slide. And we also looked at Columbia County in particular because they also lost their labor and delivery unit in 2021 at the Magnolia Regional Medical Center. You can see the jump there, 11 minutes, and now it's 45 minutes. So that's a major problem. And illustrates why it's so important that we're able to keep labor and delivery options available at our rural hospitals. That is all I have for this right now. I thought it would be important to show you guys how we can use both the claims data and birth records to do analyses like these. Yeah.
We have a question in the chat. Two questions. Mario Schutman asks, did outcomes change as a result of the hospital closings?
So we have been actually doing a lot of research studies now, modeling outcomes, various outcomes. At this point, none of our studies are time dependent, so I can't really say for sure if they have changed, but it wouldn't surprise me if they have. And then,
can you read it? Do you have that, Nicole?
Yeah, I'm reading it now. Shalise Fitzgerald is asking, for the C-section rates, did you say this was based on claims or claims compared with birth certificates? So the C-section rates were actually both. In the border counties, particularly Miller, Little River, and then there was one other county, we ended up using only the APCD birth rates, C-section rates for those counties. We chose not to supplement all of the states, or I'm sorry, all of the counties at that time. I think our methods have evolved since then to make it more consistent. But yes, 3 counties used the APCD claims, and then the other counties we used the birth records. Any other questions?
I have a question, Nicole. With regard to the C-section rates, what hospital, if these hospitals were closing or are closed, actually it's not just, it's all of this, not just C-section, where are these mothers going for their medical support and delivery?
So a lot of these are just going to the next nearest birthing hospital. We don't have we didn't actually report
Where
they were going. We didn't look at that specifically, but a lot of them also go to Little Rock. Dr. Razahari asked, for the median travel time, did you assign birthing mothers to the closest? So we actually use the birthing facility. So for the birth records, we have the hospital name, and we geocoded those and took the distance or the driving time. Actually, we looked at both, but the driving time from the zip code centroid of the mother's residence to the hospital of delivery. And we did the same thing for the APCD. If you guys have worked with identifying where services occur, sometimes you can see that it can be a little bit difficult. So we did a lot of work cleaning up our hospitals to do that piece. Any other questions? I will be here if any more pop up. Thank you.
Absolutely. Thank you, Nicole. And there is a lot more where that came from, but we'll share as it evolves. So, great. The next topic we're going to have is the review of the member enrollment selection table, because we have, as I stated earlier, we do have a couple of users who had some questions about how to use it and the results. So we thought we would give a more detailed review on this. So for those of you who have used it and have no issues, forgive any repetition. It never hurts to hear something more than once. So the MEST, the Member Enrollment Selection Table, or MEST, we'll call it, we developed it over the past year, talked about it a few times, and it is a supplemental data set that you use with your enrollment data, and it allows you to easily segment and identify qualified study populations by enrollment and coverage activity by month and year. And let's look at an example of the ugly, and then we'll talk about the pretty. So as you've used the enrollment data on the APCD, you probably know that an enrollment record is long, has lots of fields, and the enrollment dates themselves span large periods of time when their enrollment became active, and if it's still active, or if it ended and it transitioned to something else. And you have to peel apart that onion, if you will, to make sense of the actual year and month a person was enrolled in a particular plan. So we built MEST to try to cut through all of that and make it easier for you to get to those types of segmentation slices faster. In this particular example, this is the same individual. You can see they have the same member ID and the same unique ID, and the carrier that supplied these data that was Humana. It was a male. That's just for the illustration. And we're going to talk about payer type in just a moment. But this person had two different plans, you can see on the ME040 column, and was enrolled in these plans at different times. On the first plan, that the payer types labeled COM, again, that means for commercial. This person was enrolled from July 13th, 2015 to July 31st, 2016. And then the next plan was a Medicare Advantage plan, MCR_ADV. And they began enrollment in that plan in September of 2016 and ended in December of 2017 in that particular plan. So a note, you see an asterisk here by that 2015. When you get the MEST file and start using it, we've built it from 2016 forward. That does not disqualify this first record from being included. It just means that it would start from January 2016. If your study required older data than that, you would have to go back to the enrollment data. But for this purpose, we're going to say 2016 forward. So you see these two member records, big, long. Let's make some sense of it. So we put all the enrollment data through the particular algorithms to create the MEST file, and we turned these enrollment records into a record per year per payer type. And let's talk about payer type for just a moment. In that first highlighted column, we developed a large number of rules to categorize plans into plan types. COM means commercial. That means those plans are from fully commercial. They're fully commercially covered plans from carriers. Medicare Advantage, some carriers sell Medicare Advantage plans. Some sell QHP plans. There are probably 10 different payer types. The documentation that supports the MEST file has a list of all of these. And it may be familiar to you because about 2 meetings ago, again, we've done 20 of these, we talked about a new field we had called ME001 CAT, and it has all of these categorizations. So what does that mean for you? That means that we can summarize an enrollment record by the type of plan that it is. And then we do a bit of a pivot and we create one row per year per payer type and have an enrollment string that illustrates the months they were covered. So let's go back. Here are our two records. We have two enrollment records. One's a commercial plan and one's a Medicare Advantage plan. This particular record, it starts January 1st, remember, and goes through July. So if over here, it's a commercial plan, 2016, and here are the ones representing the months of coverage, and they were covered for 7 months. Let's go back. This next one is a Medicare Advantage plan, and they were covered all of, excuse me, September 16 through December 17. So this one row is going to generate two rows. One for Medicare Advantage 2016, and there are the 4 months of coverage. And then one for 2017 Medicare Advantage, and they're all 12 months of coverage. So with this type of view, you can begin to see continuous coverage, transitions in coverage, gaps in coverage. Let's go to the next one. So the enrollment string really is the secret sauce. So here's this person again with their Medicare Advantage record, and they were enrolled 4 months, 1, 2, 3, 4. And you see there in the enrollment string, and then those ones represent months, September, October, November, December. So some of our users, when they were using this, they were trying to sort of make sense of it. And one of them missed a key piece of methodology that once we pointed it out, would, oh, okay, I get it. That makes more sense now. And so we included it. It's in the ebook that has all of the methodology for this build, how to build this thing. But we included it here for your use. So what means covered? When do we put a 1 here and when do we leave it a 0? So a member is considered to have coverage within the month if the plan enrollment date is between the first day and the 15th day of the month, or if the disenrollment date is between the 15th and the last day of the month. So let's go back. So this person, well, if we had 2015 data, this person would have been considered enrolled in July of 2015. But again, we start in January. But you see that's the 13 there. So that person became enrolled in the first half of that month. So we're going to give that month to them. Again, that's 2015, not part of this, but that rule applies to anything 2016 forward from MEST. All right, if I go too fast, stop me. Happy to go back. So let's look at some more examples. When you use this file, when you use the MEST data, you can ask and answer a lot of questions. We talked about continuous coverage, overlapping coverage, gaps in coverage, and you can do it as you program for your analytic project. You can do it by focusing on the enrollment string or the months covered in the year. These two bullets give you some direction on how you might look at the enrollment string to answer your questions. The example here, in the red, well, for this particular person, they were continuously enrolled from 2018 through 2020. And for the first two, you can see they were enrolled through, what is this, all of 2018 through May of 2019. And then they got, they had some overlapping coverage in 2019. And then they were continuously enrolled all the way through the end of 2020. This one, the second one, is if you look at it and you just glance at it, it looks like, oh, well, they've got coverage everywhere. But in their 2019 plan, they were only covered February, March, and April. And then in the 2020, they started in May and went through the end of the year. But all of this time in 2019, May through December, and the first 4 months of 2020, they had no coverage, or they had no coverage in the Arkansas APCD. Who knows? They could have moved, come back. But that's why it's important to be able to manage the string values here and use your months covered in the year to identify the overlap and transitions in coverage, etc. So once you've found the people you want to look at, let me back up and say, to build your study population, it too is like an onion. It starts big and you're going to whittle down until you have exactly what you want. So if you wanted to pick continuously covered people or people who were covered at a particular point in time, you could start with MEST and get there really fast. And then you could start peeling away and to get to the exact population that you want. And once you've done that, you're going to have the member ID for the people that you want in your study. In this case, it's the SEID. And in this case, in this example, this person from Aetna and their member ID is 925. These two make up the SEID, the submitting entity ID. We got that from MEST and it was validated through enrollment, et cetera. Now with this right here, we can go into the claims data and find all the associated claims. And then this one is medical and pharmacy. There are some nuances, of course. Sometimes if it's a PBM, you have to kind of go, there's another path, happy to go through that. But the idea is you find your SEID and then you go into your medical claims and pharmacy claims and dental claims. I just didn't put dental here. And in this particular case, the question was, did the people they wanted to focus on have medical service activity or pharmacy claim activity in the time they were enrolled? So you can see that in 2022, they were enrolled March, April, May, June, July, August. And their service dates, this is the fill date and the service date, were in March of 22. So for whatever analytic question this was, it included they have to have a service during enrollment, and this particular person would have qualified. All right. We chose to include MEST again so soon after the first announcement because the question that a user asked us was, well, I need to know who's continuously covered with medical coverage. And they weren't able to get that with just MEST, and that's absolutely right. You're not able to get it, that broad coverage category with just the MEST file. The MEST file is going to get you a long way, but then you need to go to the enrollment data to fine tune it. Future enhancements on MEST will probably include something like this, but right now you have to go to the enrollment table to do this. So if you look at the bullets here, MEST should not be used to determine if a member has medical, pharmacy, or dental coverage. That's not the question that it can answer very well. To determine if a member has a particular type of coverage, you need to select the enrollment records. And then you could look at payer type. It could be payer type specific or payer type agnostic either way. But the key, the secret sauce here, is to utilize the service indicator fields, ME018, 19, and 20 on the enrollment data to determine if a member has specific coverage. And the blue box here is the link to the data users group recording we did in October about these fields specifically. You do this long enough, it all weaves together. What can I say? But let's have a review. When you get this deck, you're welcome to click on this. It'll be live and you can go to the data users group and read that. But we're going to give a summary here to help supplement. All right. The service indicator fields. If you used enrollment data, you've seen them. ME018, 19, and 20. When the intent of these fields, the carrier is supposed to flag these fields, set these fields to the appropriate value to represent the type of coverage that plan offers. Sometimes plans are just medical. Sometimes they're medical and pharmacy. Sometimes they're just dental, and so forth. And you see the values that are available. We're really interested in the ones today. So how to use them? The bullets supplement the blue boxes with the golden arrows. You collect your SEIDs from the study population from MEST. Then you go to the enrollment data and you match on the SEID and you get those service indicator fields and you determine what the coverage is for these people. Excuse me. let's look at some examples. I'd say a picture is worth 1,000 words, right? For this example, the study population requires members enrolled between 2019 and 2021 who have medical coverage. These are MEST records, and these are all real records. All of these examples you can find in the data, should you want to. Anyway, so at first glance, it looks like only 2 carriers right off the bat. I mean, two people right off the bat have medical and pharmacy, and that's because they have a Blue Cross Blue Shield plan and a Caremark plan. And Caremark's a big pharmacy benefits manager, and you can see from your payer type here. And so, well, sure, that person qualifies because they have coverage in 2019 and they have medical and pharmacy. And then the same holds true for the next one, Humana and Caremark. There they are. But let's go into the enrollment data and see. All right. So if you go into the enrollment data, you begin to see the real picture. We knew, we could tell just at the highest surface level that the first 2 qualified, because that Blue Cross plan has a 1 and MEO18 is medical services, and a 1 in MEO19 for the Caremark, which is pharmacy. Same for the next one. But this last one that was not obvious, this plan, whatever plan they bought, they includes medical and pharmacy. So you would need to select all 3 of these if that is your question. If your question is to find members enrolled between 2019 and 2021 who had medical and pharmacy coverage. So that's why it's important. If your question is that specific, that you need to know who had medical coverage or pharmacy coverage or whatever, or both in a particular time period, you need to supplement your MEST data with the enrollment data. And that was the nuance that when we introduced MEST last time, we did not talk about. It is in the documentation in the ebook, but it was problematic enough for this particular user that we wanted to share it with you specifically. If you are an external analyst and you want to purchase the MEST data along with your data request, there is a box on our data request form now to do it. Incidentally, this box here is live. It's a link to the ebook and the APCD website location for all the MEST data. If you are an ABI user, the MEST data will be included in your next subscription for it. So I believe, does anybody have any questions? I rattled through that with relative speed. And again, you can ask, we can talk offline. Does anybody have any questions at this time? No? Good. All right. The next thing we're going to talk about are the latest information about the APCD. Yay. We have about 20 minutes left. I don't know that it will take that long, but let us see. So we just did an update and the latest data is available. So we have data now through December 31st, 2023. There is some data that's a little newer than that because some carriers submit monthly, and we were able to get a few months more in when we started the build. But by and large, the data is this time frame right here. For external data requesters, this data is available right now for purchase for our subscribers. That I know that your copies will be delivered this week. It is important that you look at the release notes, and I'm going to stop sharing for just a moment because I want to go over there and show you. Stand by. There we go. Okay. The release notes and the other data that or reporting that supports a build are in this understanding the data button. Incidentally, this is the APCD website, and here's that data users group button that I said existed. So if you want to go look at the other data users groups, go here. Anyway, we're talking about release notes. So go to arkansasapcd.net and click the Understanding the Data button. And my screen looks a tiny bit different than yours because I have full admin rights, but whatever. Since we're here, if you are new to the use of these data, please, please, please review the data attributes and linking deck. Please, it will help answer so many questions on how to associate data. Okay. Release notes, if you there, look, here are the MEST documents. These are there's a deck and then there's the ebook that helps you through all of everything we just talked about in more detail. Some reporting, there we go, release notes. So if you click on this, we have, we used to do release notes as a PDF. You can see how old those are, but now it's its own little site. And so these are the release notes for, for this particular, here we go, I'm sorry. The reason that I'm doing this, there we go, is because when I opened that up, it went behind the Zoom bar. Okay, so the release notes always have some standard data, what the data is through, because not every data set is the same. For example, Arkansas Medicare fee-for-service data is through 2021, 2022 is on order. Cancer registry data is through 2020 and so forth. You can see here. And then our MEST data is January 16th through December 22 at this time. Okay. And then with each build and data submission deadline, we work with carriers to resolve issues, and the update for those is here. And generally, we did really well this year that most everything's been resolved, and if not, then there is some information about it. And it's helpful to understand if you're selecting these data, if you need to worry about anything. Our philosophy is, like, we're going to put as much data out there as possible and give you guidance, as opposed to ratcheting it back. We would hate to miss a key bit of information that might be important to you. This slide also has links to the data dictionaries and the data tip sheets. The next, well, you can't see the slide right now, but the next thing to take you to are the data dictionaries and the tip sheets. So first of all, the data dictionaries are here, except for the MEST data and the new medical marijuana data. Nothing is changed. And you can see here's the MEST right here. All right. And then the data tips and issues. Now I've got some featured data tips. Let's see. Let me unshare and reshare. Do this enough, you get pretty practiced at it. So I picked these data tips largely as reminders. There really isn't anything new right now. But we have, I don't know, 100 different little data tips that have nuances about what the data looks like. Because sometimes a carrier provides data that we have to make a slight exception for, and they simply can't make it the way it needs to be. So there's documentation. That doesn't happen very often. Don't be alarmed. But we try to document it here so that if you see something strange, you'll go, oh, okay. And that's what it is. And that's how we do it. So these are largely reminders of things that have happened before, questions that we have gotten along the way. The links in this deck are live. You can go there, and when you get the deck and click on it, but let's go back to how you even look for data tips. So on the Arkansas APCD website, you go to data tips and issues. I think we new that, and then, well, sorry guys. And then you go to data tips and issues. And you can, in this box right here, you can simply write what you want. And like, if I want to know everything about the weirdest things that have happened lately with this field. Oops, let's get over here. E040, which is product number. On the enrollment data, you can enter that and it's going to bring up everything that is related to that, including the data dictionary. But this one is in, we selected it for this deck, value suffix. If you're not signed up for the monthly data tips email, do sign up. But this says the Aetna entity 60054 utilizes a trailing character in the value of the product identifier to represent which type of plan benefit the eligibility line is reporting. So this is something specific to Aetna. It's very interesting and it might be helpful to you if you see it. So that is how the data tips work. Okay. We should be back at, yeah. Are you able to see my data tips screen now? Yes. Okay. Hope so. All right. Well, so here's some, and the data tips email comes out the 15th or so of every month. So feel free to, if you haven't signed up, do so, and we'll put you on the list. This email is for technical support. Send questions for data requests, data use, pricing, if you need our help with something. Please give us ideas for future data users group subjects. We want to help you. Again, our data needs to be easy-ish for you to use, ish, because APCD data is not easy. And we want to be able to address the questions that you have. And if there is a use that you've done that you want to share, we would love to feature you. Again, send ideas. Oh. Call to action, sign up for the newsletter. But our next meeting is October 24th, 2024. Put it on your calendar now. When you get the email that has the link to this recording in the deck, there'll be some information about how to sign up for that. So. And that concludes our data users group meeting. Who has some residual questions? Ah, there's one. Mario. In our study, we found that the northwest part of Arkansas has lower coverage in the APCD. Have there been updates about including Tyson, Walmart, and other employer-sponsored plans? That is a great question, and I have no updates except that we have an ACHI representative up there, and we are in conversations all the time. So, and we even have a bit of a precedent, meaning that, for example, Walmart utilizes Blue Cross Blue Shield as their third-party administrator, and we already get Blue Cross Blue Shield data so from other sources. So when Walmart is ready to do this, it will not be it won't be technically difficult to make it happen. Blue Cross, there is probably a cost involved, which may be the primary prohibitor. But no, I'm sorry to say no. We're still trying. Any other questions? That was a great question. No? Well, all right. Thank you very much. I'm going to give you 9 minutes back, and I look forward to any post-webinar feedback, and I will see you in October. Thank you very much.